Hello, my name is Julius Gavino, and today I'll be doing the female Foley catheter insertion. As soon as I enter my patient's room, I'm going to close the door to the curtains to ensure my patient's privacy. I'm going to perform hand hygiene, and then I'm going to introduce myself to the patient. Hello, ma'am. My name is Julius. I'm going to be your nurse today. Can you please verify your first name, last name, and your date of birth? Okay, so I got I got the right patient using the two patient identifiers and looking at her wrist. Um, all right, Mrs. Smith. Today the doctor has put in an order to put a placement of a Foley catheter, which is a tube that's going to sit inside your bladder. That's going to continuously drain your urine. Is it okay if I can place that on you today? Okay, so I got the uh, consent from the patient. All right, Mrs. Smith. First, before we do anything, I'm gonna clean your area first, and then I'm going to walk you through the whole Foley catheter insertion process. Okay. So I'm going to perform hand hygiene. I'm going to put on my gloves. So I have two washcloths. I have one wet cloth that has no rinse soap base, and my other washcloth is a dry cloth. First, I'm going to uncover her blanket. I'm going to position her legs where she's frog leg stance. I'm going to adjust the height of the bed where it's work accessible for me. And since I am right-handed, I am going to stand on the right side of the patient. So, all right, so Mrs. Smith, first of all, I'm going to clean your area first. You're going to feel my hand touching around your area right here. Okay, I'm going to take my first wet cloth over here, and I'm going to wipe from anterior, posterior, far side. And then I'm going to wipe anterior, posterior, near side. And then I'm going to wipe anterior, posterior, meatus. Okay, then I'm going to dry using my dry cloth from anterior, posterior, far side, and then anterior, posterior, near side, and then anterior, posterior, meatus. I'm also going to check on her anatomy for an opening through her meatus, and I'm also assessing for any discoloration or discharge or malodor smells. Okay? All right, Mrs. Smith, I am now going to perform the sterile part of the procedure. I'm going to remove my gloves and perform hand hygiene. And this is a sterile procedure. I am going to place the Foley catheter between your legs. If you can do me a favor, if you cannot move or touch while I'm doing the procedure, okay? So I'm going to show I have the right Foley catheter kit, and this is a 14 French a Foley catheter with a 10 millimeter balloon. I'm going to carefully take the kit out of the box like this and place the kit between her legs. I'm going to use the outer part of the bag as a garbage disposal. I'm going to slowly, by using sterile technique, to open the kit nice and slow, only touching the 1-inch margins of the sterile kit. I'm going to take my gloves, place it on the side. I'm going to finish opening up my sterile kit, just like that. I am now going to perform open glove. And as I am wearing my gloves, I'm going to ensure that I don't have any rings or watches. Okay, I'm going to put my gloves on. Okay, I'm going to discard this out here. Alright, Mrs. Smith, if you can carefully lift up your hips, I'm going to first put the first drape over under her hips like this. Thank you very much. And I am now going to carefully take the other part of the drape and place it over her area like this to expose the fenestrated hole through the drape like that. Okay. I'm now going to take my alcohol swabs, open it, and take my swabs out and place them carefully where it's easily accessible for me to reach. I'm going to take my lube and open it. Okay. I'm going to take my Foley catheter tip, take the wrapper out, and lubricate the tip like this. And then I'm going to take my syringe and attach it to the Foley. Make sure it's nice and tight. Alright, Mrs. Smith, you're going to feel my hands here while I clean you first. I'm going to use my non-dominant hand and place my hands here just like this. So open up the medius, okay? I'm going to take my first cotton tip and I'm going to swab from anterior to posterior far side. I'm going to take my other tip and swab anterior, posterior, near side. And then I'm going to take my last cotton tip and swab anterior, posterior, medial. Okay, I am now going to grab my Foley catheter, grabbing from the 2 to 3 inch from the tip. Alright, Mrs. Smith, before I enter this, I want you to take a nice big deep breath for me. And as I exhale, I'm going to insert the catheter in there for you, okay? So deep breaths in and deep breaths out. Okay, I'm going to advance the catheter to 2 to 3 inches in, and I'm going to visualize for any urine that's flowing into the catheter. Okay, I'm going to hold this. I'm going to take my clean hand and I'm going to inflate. And then I'm going to take this out. Now I am going to pull back gently until I feel resistance. Okay. And then now, Mrs. Smith, I'm going to perform perineal care. Okay. I'm going to take the tubing and I'm gonna place it onto her inner thigh of the patient's leg, on her right side of her leg, and I'm going to take her drainage bag and place it into the unmovable part of her bed, and making sure that the drainage bag is lower than the patient's body. Okay, and then I'm going to take my supplies and drain it into, or not drain it, and dispose it into the garbage. So here for now. I'm going to take out my gloves and perform hand hygiene. Okay, Mrs. Smith, please use a call light if you're gonna get up and walk up anywhere. And if you have any questions or if you have feeling any discomfort, please use the call light to get me. So I'll continue to come in and out just to assess if you have any obstruction or any discoloration on your urine. And if you're planning on moving around your bed, please make sure you have enough slack so you're not pulling on your catheter. And if you have any other questions, I'm going to be doing my documentation. Thank you.